Good morning. My name is Cindy Mellon, and I'm a safety consultant with the Pennsylvania OSHA Consultation Program. I've been with the Consultation Program for about 23 years, and I work in the eastern part of the state. Today, this webinar is going to be about the S.H.A.R.P program, which is offered through our program, the OSHA Consultation. So let's all discuss about S.H.A.R.P. Before we get started, I just want to go over some housekeeping items, basically. This webinar is going to be recorded, and it will then be uploaded onto our website. The chat is open, so you may ask questions, but it is not live. Because of the technical nature usually of the questions, we will answer them offline, and then the answers will be on the website within 7 days after this webinar. Also, make sure that you're using the audio through your computer speakers, because that is the only way you're going to be able to hear this webinar. All right, the Safety and Health Achievement Recognition Program is called S.H.A.R.P. What this basically is, it's a program offered by the Consultation Services, and the general idea is that you're the best of the best. You have an exemplary safety and health management program, and your OSHA rates are better than the industry average. Actually, to clarify that, they're actually lower than industry average. What these rates are would be typically your total recordable cases and your days away restricted or transferred DART rate. Excuse me. What this basically gets you is that you're exempted from OSHA programs inspections, and most of the time it would be up to 3 years. What are your requirements to be into S.H.A.R.P? Would be that you must be a fixed single work site, and you must at least have 1 year of operating history. You also need to exhibit a reasonable promise of achieving your milestones, such as the program recommendations that I will address in the rest of this program when we're going over attributes that you must have. And the other thing is you must have 250 or fewer employees on site. Employers that have 251 or more employees, we usually try to encourage to participate in a similar program that OSHA runs called the VPP, or OSHA's Voluntary Protection Program. S.H.A.R.P requirements, you cannot, there's some very major things that you cannot do once you meet these requirements for your lower rates and things like that. You cannot discourage injury and illness reporting. So such examples of this would be possibly awarding paid time off or other benefits with no injuries if a company is awarding that. The other thing is rewarding a department, specifically in a company, having a competition that which department has the greatest reduction in your incident rates or lowest number of injuries. Some of the acceptable things that are encouraged that OSHA would want you to do as far as incentives would be to encourage safety awareness and injury and illness reporting. Also encourage worker involvement, and provide positive incentive programs to encourage or reward employees. So you want to, examples would be possibly providing free T-shirts to workers serving on the Safety and Health Committees, or offering modest awards for suggesting ways to strengthen your safety and health program. Some of the S.H.A.R.P requirements continued. What you will do to get started is that Consultation would actually come out and consult with you to provide a full-service safety and health visit. Also, you would receive a comprehensive review of the management system, and that is done through what's called our OSHA Form 33, which is called the Safety and Health Program Assessment Worksheet. On this worksheet, you must get at least a score of 2 on the 50 basic attributes of your program on this worksheet that is using to assess your program. And once you do all of that, in addition, if there are any hazards that have been identified during the visit, those obviously must also be corrected. The hazards would include the imminent danger and serious, which you would have to do anyway, but also other than serious and regulatory hazards need to be corrected to be in the S.H.A.R.P. You also must agree to notify our program director if you have an on-site visit, for us to come to do an on-site visit, when there are changes in your working conditions, or if the processes that occur might introduce new hazards into your workplace. Also, you would submit a request for pre-S.H.A.R.P or S.H.A.R.P participation, and I will get into a little bit what pre-S.H.A.R.P is as well as you need to submit an action plan to the program director. Right now, we currently have 54 employees that are in Pennsylvania that are in the S.H.A.R.P program. As I mentioned before, the pre-S.H.A.R.P program was also called the Inspection Deferral Program. What this is for employers that are not able to meet all of the S.H.A.R.P eligibility requirements. Some of those things would be not having a TRC or a DART rate that is lower than the industry average. Or it could be that on that assessment worksheet, that Form 33, that you're not scoring a high enough number on that, a 2 or a 3 on that. And again, I will get into the scoring in a moment. One of the things that you want to do, though, is also we have to be assured that you would be able to meet those S.H.A.R.P requirements during the deferral period, which could be up to 18 months. And right now, we have 4 Pennsylvania companies actually in pre-S.H.A.R.P. So what I've been talking about, and we'll be talking about for the rest of this webinar, is the Form 33. It's basically the heart of it all. This is the Safety and Health Assessment Worksheet, and it's actually a tool to look at to evaluate your safety and health system. It's actually made of 3 main parts, components, which make up the organizational safety and health system: operational, managerial, and cultural. In this form as well, there are 58 attributes that are evaluated, and these are the things that we are actually scoring and looking at to see if you have in place. Out of the 58 attributes, there are 7 categories that they're divided into: hazard anticipation and detection, hazard prevention and control, planning and evaluation, administration and supervision, safety and health training, management leadership, and employee participation. And again, all of these I will go over individually. So scoring the form is basically we'll come in, go over the form with you, and we want to see if you as a company have that attribute in place. So out of the 58 attributes, there are 50 that are mandatory, that you must get a 2 or a 3. So the scoring goes that if you score a 0, that means that you do not have that element in place. If you do score a 1 on it, this would be probably for a inspection deferral company. This would mean that you would need major improvement on this element. A 2 is what we're striving for, 2s and 3s. A 2 would mean that you do have that element in place, but it only needs minor improvement. It just needs to be tweaked a bit. And 3 would mean that you have it absolutely in place and you don't need any assistance from us to have that attribute correct. Also, there's not applicable or not evaluated. And again, out of the 58 attributes, there are 50 that are mandatory to get a 2 or a 3, and 8 of them are what we call stretch items, because these are not necessarily that you would need to get a 2 or a 3 on, although we would hope for a S.H.A.R.P company that you would. But it means that these are a little difficult to actually ask the company to try to put in place, but if they have them in place, that's even better. So the first part, the first component of the form is the operational component. This basically concerns the safety system output regarding workplace hazards. So what we're looking at in this is unsafe and unhealthful conditions and activities. There are actually 19 attributes on the form which are part of these first two categories, which is in the operational component. So the operational component has the two areas with concerning workplace hazards. So hazard anticipation and detection are the attributes between 1 and 10, and then hazard prevention and control are the attributes between 11 and 19. When we're looking at the first three attributes, which are hazard under the hazard anticipation and detection, what we're looking at is a comprehensive baseline hazard survey that has been conducted in the past 5 years. The other things that we're looking at are to have effective safety and health inspections performed regularly and effective surveillance of established hazard controls. Throughout this webinar, we'll actually be talking about attributes. Most of them they are deemed as being effective, that you must have an effective program or an effective rule or effective inspections. What this is basically saying is that for anything to be effective, that for a workplace to be effective or a workplace practice or a rule, it must be in place, it must be corrected and sufficient, it must be communicated, and it must be followed. So again, throughout the webinar, these slides, the attributes, most of them you have to have an effective, that has to be an effective element. Effective surveillance, basically what surveillance is defined as is that it's an inspection, but it's not a formal thing necessarily, but it would be ongoing. So to have effective surveillance, you would, for instance, as the consultant would be walking through the facility and you would see PPE was not being worn. That would indicate that surveillance of the controls was ineffective. Hazard anticipation detection are the attributes 4 through 5. And this is looking at an effective, again, reporting system, meaning that you would get prompt feedback. So how the hazard was corrected or why not. So when an employee or somebody would actually report that hazard, you want to make sure, in order for it to be effective, that you do get that feedback. This also, of course, assumes that the employee themselves is aware of the hazardous condition and knows the harm it represents. So this will actually carry through to other attributes that we'll be looking at. Change analysis is another thing that we'll be looking at. And what this means, it says change analysis should be performed when there's a change in the equipment, the materials, or the processes. So a change analysis basically is a procedure in place to detect in advance what the potential hazards would be and what changes would need to be made. It's, if you will, a planning for planning. Hazard anticipation and detection attributes 6 through 10 are pretty general again. It is accident investigations are investigated for root causes, again, meaning that they are effective. The safety data sheets, not just specifically what you're required to do for OSHA, but you want to make sure that the safety data sheets are actually addressing to assist with prevention and eliminate hazards from the chemicals. So you want to make sure employees are aware of that, what the actual hazards are. And again, an effective JHA or job hazard analysis. This would be a formal technique for those as a review of what a JHA is. It would be basically recording each step of a job and identifying their potential hazards, as well as determining the best way to do the job to eliminate those hazards. Expert analysis would be considered industrial hygiene visits, surveys, ergonomic evaluations. Those are things that OSHA is also looking at, and we're looking at to see if you've had any of analyses from experts performed. The last item on this slide is that incidents are investigated for root causes. So this, again, is a stretch item, if you notice, and this would be incidences, would be things such as a close call event, such as first aid. So it's not recordable, and it's considered a stretch item because sometimes it may be a little bit more difficult to implement. A lot of times companies have a hard time trying to make sure that your employees are actually reporting everything and that's recordable, much less asking about the first aid. But this, again, is an element that for a S.H.A.R.P company you would want to make sure is in effect. Attributes 11 through 19 is starting the second section of the operational control part, and it is on the hazard prevention and control. So basically we're looking at exactly what that says, the prevention of hazards and their control. So some of the things are pretty self-explanatory on this slide, but engineering controls, so what's technically and economically good to implement the actual control. An example maybe would be soundproofing a piece of equipment. Now, what this means is it doesn't require that the control has to be in place and actually take away the hazard. It could be something that you're controlling it, but you may still need additional things because it has to be something that's economically feasible. So again, you could soundproof a piece of equipment, but you still may need to wear hearing protection. Again, the old effective word is coming in there. So you want to make sure your safety and health rules are actually effective and your work practices are effective. Again, meaning they must be in place, corrected, and sufficient, communicated, and followed. You want to make sure that you're effectively implementing your applicable OSHA standards, and also you want to make sure your PPE is effective. So how does that become effective? It means that your PPE, your personal protective equipment, is actually available, it's maintained, and it's used. The other, another item on this list is housekeeping. So aisles would be marked. You would have no tripping hazards. You'd have your exits cleared. The next thing, emergencies and competent medical care that you're prepared with. So for your emergencies, you'd have drills and written procedures, competent medical care, first aid, CPR. Preventive maintenance, effective preventive maintenance is performed, again, a stretch item. And the reason is because some companies won't necessarily have a formal preventive maintenance program, but as a consultant, when we come in, we'll want to make sure that past accidents or instances in which there might have been maintenance deficiencies would be the contributing factors would be looked at, as well as to identify hazards involving the maintenance problems, if there is anything like that. The next component, the second one of this whole form, is the managerial component, and this basically concerns the effects of a traditional management function. In this component, there are, it's probably most of the form. It's more than half of the Form 33. It includes 20 attributes. These attributes look at 3 categories: planning and evaluation, administration and supervision, and safety and health training. With the planning, attributes 20 to 23, what we're looking at here are, it says injury, illness data are effectively analyzed. So what we want to see is that is the company actually analyzing your illness and incident data? So looking at maybe possibly what's the actual hazard type, or looking at when the injury occurred or the incident occurred, looking at time trends, looking at the severity as well. And that would be how you would be analyzing it. The next thing is that safety and health goals and supporting objectives exist. So goals must have objectives, and the objectives must be, the old acronym is SMART, which means that they're specific. The objectives must be measurable, achievable, result-oriented, basically result-oriented, they're tied to their goal, and they must have a time frame. And for S.H.A.R.P, we usually want it to be less than a year. And of course, you need to have an action plan to make sure your objectives are in place. So that is basically assigning the actions that need to be completed within a planning period. The action plan must actually also have an action statement, and that would assign responsibilities and have the completion dates on them. The next attributes, 24 to 25, again, pretty self-explanatory here, but does the company have an annual review of your mandated OSHA programs, such as like confined space entry or lockout tagout? And also, are you reviewing your safety and health management system? This, again, is a stretch item. It should be a formal review. You want to make sure you're highlighting accomplishments of the past year, as well as identifying failures of the past year. And from this, you want to correlate your action successes and the failures with the outcome results, such as your injury and illnesses that may have occurred. Attributes 26 to 33 are basically talking about assignment of safety. This is getting into the administration and supervision part of the form. You want to make sure you're identifying that tasks are specifically assigned. You don't want to, some companies will go in and they'll say, well, safety is everybody's responsibility. That's not totally it is, but you want to make sure that you're assigning your safety and health tasks to somebody specifically so that they can be accountable for it. And we're also looking at how these tasks themselves are actually communicated within the company. Again, back to the accountability, again, a stretch item, but the old management adage, what gets monitored is what gets done. So you do want to make sure that you are having some accountability with the assigned tasks. Also, the people who are actually assigned must have the knowledge, which means like skills and abilities of how to do it, authority over the work, authority over the resources. And this is actually important because they need to be able to have this authority so that if for some reason a resource wouldn't be available, what are they going to do to replace that resource? And also, the last part on the slide is individuals rewarded or disciplined for meeting the safety and health responsibilities. So you want safety, you obviously would like to do positive rewards, which would mean try to motivate employees to meet their responsibilities, and it would be improved personnel evaluations, which the positive things could be bonuses or recognition. But the best rewards obviously are immediate and certain. You don't want to, or you want to try to stay away from the negative reward, so to speak, which would be discipline. This is because oftentimes before you do a disciplinary action, you would want to make sure that there is, check what the underlying cause of the problem is. Maybe it's a work design, it could be job engineering problem, or the task itself was actually poorly delegated. So that's why the person who was assigned was not able to get the task done. So you might need clear communication, and also the performance or feedback may not be given. So you may have no communication is good, as well as the training might have been insufficient. So you have inappropriate resources for that, for the training. And speaking of training, that's the next set of attributes, 34 to 39. This is basically dividing it into the types of training that different employees within the company should have. So employees are considered the non-supervisory people. So they could have the formal or informal training, such as on the job or off-site training. The other type of training would be through new employee orientation. So you would want to make sure that we're looking at what new employees are actually being trained during their orientation. The supervisors, you want to look to see also what their knowledge of the safety and health program is. Are they actually, responsible for doing things such as identifying hazards? And are they actually looking at, do they know how to maybe handle emergencies or how to make sure that a hazard is corrected? The supervisors also, these are responsibilities that they would have, again, a stretch item, but some things that they might also have responsibility for is how are they actually motivating their subordinates? Are they able to actually do the training? Top managers and middle managers also are, you want to, and this is oftentimes difficult as a consultant to initially determine, but really the reason this is a stretch item as well is because managers, it's been found that managers who actually identify what the safety and program, the impact that it has, and it will actually impact the overall effectiveness of business. Those that understand that are actually more likely to ensure that the safety and health management system operates as needed. So these are things that you want to, when we come in here, we want to make sure that managers are aware of the importance of the safety and health management program, and that they're aware that it has an effect on turnover, absenteeism, productivity, and morale within the company. Cultural components is a lot of it is just looking at the values and the principles that are held by the organization. So there are only 9 attributes in this section, but they encompass the management leadership and the final ones, the other 9 ones are employee participation. All right, so management leadership, attributes 40 through 49. This is, again, it's looking at top management policy. What's the top-down approach? Is there a priority for safety and health relative to other organizational goals such as profitability or productivity and quality? Also, is this policy actually effectively communicated down to your middle managers and the supervisors and the line employees? On here, it does talk about, and we'll talk a little bit later too, about line function. Basically, that is a person, the delegation comes straight from the top, so from the top manager down to the top managers down to the line managers. And you want to make sure that that is actually encouraged and that line managers are aware of that top management does have this priority for safety and health. The staff would also be people within management, but they provide support to the line managers. They could be people on the safety committee, they could be a safety director. Also with the, we want to look at how top managers, are they aware of, do you have a safety and health evaluation? Is there efforts by the organization to make sure that you're soliciting employee participation and that it's encouraged? So another part of that is very important is that managers themselves are actually following the safety and health rules. And an easy way to determine this is, again, if the company requires employees to wear safety glasses, are the managers, as you're walking through the facility, taking you through, are they actually wearing the safety glasses as well, kind of following what they preach? Managers, to delegate the authority, are they allocating the resources needed to provide a good program? Are they ensuring that there's safety and health training? And are they supporting the effective disciplinary and reward policies? Again, much of this goes back to what we talked about earlier with the cultural components. The last set of attributes is employee participation. This one is always a little difficult to evaluate right away, but what basically we're looking at is there an effective policy to actually involve employees in the safety and health program? So what we're looking at is there actually a solicitation of input to have employees participate, such as examples would be, are there emails or corporate-wide meetings asking for input? The next thing is once you get that input, how do you receive it? Do you do that through suggestion boxes? Is there a chain of command? Does management have an open door policy that they always want to hear about safety items? Generally, the most successful companies have a joint labor management safety and health committee. In Pennsylvania, we have that, and it would be that would be a great way to ensure that a small group is actually represented, and so employees can be represented by the small group of people. The third thing is you want to make sure that this input that employees are giving is actually acknowledged. So these are all things that would indicate that employees are actually involved in the safety and health program. Again, a reason this is a little difficult to evaluate is because oftentimes companies get upset when you're asking, are employees involved with their suggestions and things like that, because it indicates on the form that employees have more input than management does, and this is not what that's indicating. It doesn't mean that employees are allowed to change the decision-making authority vested in management. It's just the fact that you want to make sure that, and we're looking for to see that employees' suggestions are actually sought after. Again, the safety and health training of coworkers is something that's a stretch item. It's more or less, we're looking at something more unofficial and informal, such as like a mentoring program. Is there a mentoring program to instill safety and health values into new employees? And the last things are, how employees are actually participating in the safety and health program. Do they participate in the annual review of the program? Are they participating as well in the review of the OSHA mandated programs? Are they assisting with analyzing injury and illness data? And this would be maybe a function of even the safety committee as well. So now that I've talked about the Form 33 and kind of what the S.H.A.R.P program is all about and how it's evaluated to get into S.H.A.R.P, basically, what are the benefits of being in S.H.A.R.P? Well, it comes down to almost bragging rights. You would be in S.H.A.R.P one of 54 companies in Pennsylvania with this status. And so that's, when you consider how many small businesses are in Pennsylvania, that's quite an accomplishment. Also, obviously you'd have to have lower incident rates to be into S.H.A.R.P, which would probably mean that your workers' compensation costs would be lower, as well as obviously you would have to have a safe working environment. So in conclusion, Pennsylvania Consultation Program is really a great service for Pennsylvania employers, and in fact we do often hear that it's one of the best kept secrets in Pennsylvania. Our repeat business tells the story. We have companies that call us every year to have us come out as another set of eyes to help them get into OSHA compliance. what we will do as on the consultation program, kind of some background is that it is designed specifically for small and medium-sized businesses. One requirement is that we do require that it's only 250 employees at a single site or 500 corporate-wide. And we will give assistance priority to the employers that are in a high-hazard industry and involved in hazardous operations. Large businesses are actually welcome to put in requests, and they will be honored, but the scope of the visit would have to be limited. Again, no citations and no penalties. So this is the big thing that's different from OSHA enforcement. We do not issue citations for violations, and we do not impose penalties for violations. Employers' obligations, though, you must agree to correct any serious or imminent danger hazards identified. And for S.H.A.R.P, as I mentioned before, you must also correct the other than serious or regulatory hazards. You also could be referred to OSHA enforcement if you refuse to correct the hazards. This is very rare. I can say that I've been, like I mentioned, with the program for 23 years, and I have never needed to refer a company to OSHA because most companies want to do the right thing, and so they have always corrected the hazards. Cost and savings, it's free of charge. You can't beat that. You would avoid OSHA penalties and litigation costs. You can reduce your workers' compensation costs because of we're assisting you with your safety and health program, and also minimize equipment damage and production losses. One consultant identifies an average of 7 serious and other than serious hazards. So that is quite a savings that an employer could get, especially if they had an OSHA inspection that could save you at least $87,000 in OSHA fines per visit. So how do you contact us? We are located in Indiana, Pennsylvania, and you can call our number and put in a request. We also have a website, which, as I mentioned earlier, this program will be uploaded onto. And on the website there is a request submittal form, so you can put a request in that way. You can also check us out on Facebook and on Twitter. Again, other questions, please feel free to submit questions during the chat here. We will answer the questions on our website. And the next upcoming webinar is going to be on workplace violence. It'll be of January 19th of next year, 2018, at 10:30 a.m. Anyway, I hope that you enjoyed this webinar and learned something from it. I appreciate you taking the time out of your day to attend this, and have a very safe day.